but I'm not sure how developed it was.
Oh, yeah.
So,
It did
yeah.
not develop well, so,
You can sit down now. You
Okay,
both can
awesome.
sit down if you want. You use 30 seconds of prep time.
Can I bring new stuff up in the rebuttal? Or
No.
No?
Yeah.
Oh. That's why this is a learning experience.
That's right. That's right. That's why we're taping the whole thing.
Yes.
So even our commentary.
Okay.
Do we do the reflection or is that just those two?
No, just
Okay,
them.
so this is our part then?
Yeah,
Okay.
yeah. That's your part.
Okay.
Okay, you used 1 minute and 5 seconds.
Let's go, let's get some class going.
All right, first off, one of the major points my opponent stated right there was scale, taxes, pleasing the public, politicians pleasing the public, and those seem to be the main ones. I'm gonna start off with scale. First off, scale really isn't that much of an issue because he mentioned that there were only something like 32 million or something like that in Canada. However, we have more citizens to tax in the United States. So that's really not that big of an issue. If anything, it may be a leadership issue, but we have some of the best leaders in the world in the United States. So that point is wrong because of that. Let's see, also politicians pleasing their constituents. There was a problem in his argument because he stated that politicians would want to please their constituents by not raising the taxes. However, it may actually be better for the country if they were to raise the taxes, just like it would be better for the overall country if a single-payer system would be implemented and people would be able to get that basic health care. And if you had pneumonia, you could go to the hospital and not worry about the payments. Also, according to Flu's PhD, who is an executive director of the Division of Behavioral and Social Science and Education at the National Research Council, Americans are dying and suffering from illnesses and injuries at rates that are demonstrably unnecessary. Superior health outcomes in other nations show that Americans can enjoy better health while per capita income insurance overhead costs have tripled since 2006, reaching 731 billion. Switching to a single payer system today could save more than 400 billion annually. So my opponent's thing about taxes, just switching to the single payer system itself would save $400 billion. So taxing the public, increasing the taxes on anything, and obviously you want to tax the bottom 10th of the United States population. You would obviously be taxing the upper, the 1% type of population. But that being said, $400 billion would be saved by switching to a single payer system. There was also an issue with one of his sources, Ezekiel. Let's see. He mentioned interest groups, and the interest groups that he was talking about were drug companies. And I find it hard to believe that drug companies or anything in the medical or the established medical establishment as of right now would be pushing for a single payer system because they would lose billions of dollars of profit for themselves that goes to their stockholders, not the citizens. They may be citizens of the United States, but it doesn't go to the mass majority of the citizens. Therefore, his article may not be completely, or it seems to be a little biased towards insurance companies, drug industries, and interest groups of that nature. Also, let's see. He said that it doesn't work in other countries. However, according to Zai Wei, MD, scratch that. According to Hellender, Director of Health Policy and Programs for Physicians, the National Health Program, Taiwan's NH1 National Health Insurance was approved in 1994 and was implemented less than a year. About 41% of Taiwan's population was uninsured before the reform, compared to 16.3% of the US population before passing the Affordable Health Care Act. Today, 99.9% of Taiwanese are insured and enjoy free choice physician. Therefore, if a country like Taiwan can provide basic health coverage for their citizens, a superpower such as the United States, that's one of the wealthiest in the world, should be able to provide the basic health care for its neediest citizens and its richest. That's all that I have.
Okay. All right, David, do you want to use the rest of your prep time?
Yes, please.
Roll over?
You mean between rounds?
Right.
No. So you get 4 minutes every round. Yeah.
Oh, okay.
So it's not by speech, it's by the whole time. So you can divide it up how you want.
Yeah, that's what I meant, like
Oh, yes.
4 minutes throughout the whole debate.
Yes, sorry.
Yeah, sorry.
You couldn't like collect it though and use it all in like the final round. I guess that's what I thought you meant. $30 seconds used. $30 seconds remaining. That's time.
Alright, sweet. Okay, are we going? Okay, sweet, just checking. Okay, in terms of rebutting the scale discussion, I would like to point out again to something from Professor Ezekiel Emanuel, which is in terms of the scale. Furthermore, a plan covering all Americans would be much larger than Medicare. It would have to process more than 1 billion physician visits, 40 million hospitalizations, and 3.7 billion prescriptions filled each year. This would require sophisticated information technology. So that technology would be a major administrative cost, and keeping it updated would be politically difficult. As we have seen in the IRS and the FBI, there is a great aversion to spending money on major IT upgrades. In other words, because we have so many people and the scope of the amount of information to keep track of all of this, it is too great, and Congress is not willing to, over time, properly allocate the funds to keep an update system that would be feasible and would work. Additionally, the government has only actually been able to do a single payer thing barely through the Veterans Affairs, but that's only 13 million people. We're talking about the US, which is over 300 million people. So we can do it for 13 million people, but we can't do it for the entire country, which is the stated plan of over 300 million people. Additionally, I would like to counter the talks about politicians, where my point with politicians is not tax-based. Taxes is more the fact of taxes were mentioned, and it's the fact that it was never specified at that point of who actually would be paying the taxes. So that's been clarified, so I feel like that point is now moot. And Collin mentioned that saving money was never mind. But I would like to reiterate the fact that politicians do have the conflict of interest with the different groups who lobby Congress and do political or campaign donations and stuff like that. And then Collin also mentioned how the Ezekiel author could potentially be biased towards drug companies and how that could relate to a loss of profit. And I would just like to point out that that loss of profit could cost people their jobs currently, which would definitely be in some way a disadvantage where these people would then be unemployed, which could hurt the economy. These people would not be able to provide for themselves, and a loss of profit could also lead to a lack of innovation as well, because we're taking money away from these companies who originally would be spending that money and reinvesting it. For example, Professor Ori Reinhardt stated, on the other hand, the extremely low profit margins yielded by a single-payer healthcare provider makes hospital innovation in healthcare products and services, and I botched saying this. I'm going to restart that. On the other hand, the extremely low profit margins it yields, the provider of the healthcare makes single-payer systems less hospitable to innovation in healthcare products and services, and in the organization of healthcare delivery areas in which the U.S. excels, sometimes to excess. So in other words, our current system right now actually is great at being innovative, and if we switch to single payer, as suggested, we're going to lose some of that innovation because there aren't going to be as high of profits, which that's part of the cost of healthcare goes towards researching new techniques, which eventually save people's lives, so that's very important. That's all that's said. So.
Okay. All right, Collin, you have 2 minutes and 55 seconds of prep time. Do you want to take that?
Yeah.
Okay. Are you all getting some ideas? 2 minutes remaining. So on this ballot, because I'll start packing up while you're writing the ballots, you can rate them as speakers, so that's what this top part is. Did you think they were persuasive? This is more kind of on the speaking ability. And then the voting, whether you vote for the affirmative or negative, that's based on the arguments on your flow.
Okay.
And then under the reason for decision, just write some reasons why you voted the way you did.
Okay.
The line next to affirmative.
Okay.
The line next to affirmative and negative, they're just the names.
Yeah, you just put in Collin and David. Yeah. I feel like I gotta put a sign on the door. Like,
Yeah.
there's a class in here. Stop barging in.
Like there's so many rooms with open doors on this hall. It's like you pick the one with the closed door. Really?
Yeah, I know.
And that was the same person from the.
Was it? Oh my
That's,
god.
On it.
I actually did think about that. I'm like, should I put a sign on the door? It's the final countdown.
Alright, so major claims were, well, first I'll start off with scale. Again, the scale is not an issue. He said 13 million people are provided for through veterans. However, again, there are more people in the United States than in Canada, so there are more people to tax and there is more revenue coming in. We also have a much larger economy than Canada. Also, politicians, you mentioned that they might not represent the people as well. However, I'm sure that the politicians represent the people more than CEOs of businesses that are only answering to their board and to their stockholders. So there's really little oversight from the people on them unless they majorly mess up, such as Enron, and they go to jail. The unemployment part, this is obviously going to create new jobs in the government, so the people that do lose jobs in the medical sector could simply transition over. And this is a normal thing in the economy for when something, an industry comes obsolete, they transition into a new industry. The lack of innovation. The lack of innovation, well, when 29.2 million people will be uninsured and they are fearful or they worry about paying for their co-pays, the lack of innovation is not the major concern. The major concern is providing basic health care to people in the United States. Let's see here, and what is it? Let's see. And to add to this, RNs and doctors are both supporting these plans, the people that are seeing this on the front lines. So for instance, in a medical journal, it was reported that more than 40 RNs from throughout the United States, including Texas, one of the most conservative states in the United States, Florida, Minnesota, Missouri, New York, and elsewhere, brought a special and powerful message. We need to guarantee a single standard of safe, therapeutic care for all and ensure that changes in healthcare delivery and on the provider side do not undermine that guarantee. Therefore, RNs and doctors are in support of this plan. the people on the front lines.
All right. Okay. So,
Wait, what does RN stand for?
Registered nurse.
Okay.
so, I'm gonna let these two are gonna be writing on their ballots. What questions or things came up that you had questions about from this debate? Or did you have?
It's more, I know what I need to do better.
Okay,
So,
well, that's good. That'll be easy to write your reflection then.
yeah,
How about you, Colin?
We work better on utilizing the 4 minutes
Mm-hmm.
for
The
preparation.
prep time, yeah.
Coming up with some kind of system, putting in order of the scholars that you want to use.
Yeah.
Because I really needed that, I noticed.
I liked what David did in that he didn't staple them together and that he did them single-sided. I think that makes it easier to put them in the order. That's kind of like how the front lines are envisioned, right? Is so you have cards that are related to each other. I mean, you have the 1AC, right, which is all in order, but then you have cards that are related to each other on the same page. So that way you could mark, I'm gonna read this one in the negative constructive, and then maybe if I need backup, I can read the second one, right? That's kind of the idea. So, but yeah, not having them drift from one page to the next is also kind of, one thing I noticed, which I know we haven't talked about, so I'm just gonna talk about it right now, is kind of strategy for the rebuttals. And so I have in the rule of 3, 3 things. And I'm gonna write them on the board, so that
You gotta sit back down at your normal desk.
you can if you want. So the first thing, so every rebuttal should start with like 30 seconds of